everyone. My name is Chris Hunter from Central Pennsylvania HIMSS. I'm very excited to be here with everyone today. I want to welcome you to our webinar series where we will be featuring experts in the fields of healthcare and technology located in and around Pennsylvania. If you haven't had a chance, please check out our first webinar. It's up on our YouTube. It's featuring a discussion of the importance of women in STEM. And if you're not already, please follow us on social media for more great content. There will be a link under this video for our social media links. Today, very excited to introduce our next guest to the webinar, Dr. Mark McKinney. Mark is an assistant teaching professor for the Pennsylvania State University, where he instructs graduate courses in the Masters of Health Policy and Administration. Mark has a doctorate of education from the University of New England and a Master's of Public Administration and a Master's of Arts from Webster University. Mark is also a retired U.S. Army Medical Service Corps officer. Mark, I want to thank you a lot for your service. Really appreciate it.
Thank you. Appreciate it. Thank you.
Mark also holds, I believe, Mark, is it 8 certifications in IT and IT security now?
Yes, sir. Most of them through CompTIA, and now I'm working my way through the Microsoft certifications.
Excellent. So timely information, because today our topic is cybersecurity in healthcare. So without further ado, I want to introduce Mark. Let you take it away.
Well, thank you very much. I greatly appreciate it. And before I get started, I always want to start my presentations or seminars with understanding, to open your minds and to understand the situation we're in. As we are adjusting to the coronavirus, a lot of people would think, oh, well, there are not cyber criminals out there trying to take advantage of you, because they just wouldn't do that in such a dire situation. And I'm here to tell you, yes, they will. The cyber criminals, or bad actors, is what we like to call them, often do whatever they have to or whatever they can in order to generate a profit. And then there's some individuals that just do it because they want to and because they can. So as we ask ourselves, think about this, and what is cybersecurity? There are a lot of definitions out there. A lot of people have various comments and concerns about cybersecurity, but in the short, it's the protection of computer systems and networks. And that's simply what it is. Now, cybersecurity includes much more than that, and we're going to delve into the details of that. Also, who are we protecting? Are we protecting computer systems and networks, and who are we protecting them from? That's one thing that we need to make sure that we keep mindful of throughout this presentation. Okay, when cybersecurity occurs and there's bad actors, the first things you think of are hackers. And we see these oftentimes in a lot of movies and a lot of situations. Hackers are the ones that do most of the damage, but they're thieves, and they could be one and the same. So with that said, I'd like to start out with a couple of stats as I lay the foundation. In 2020, these are some of the large healthcare breaches that we've encountered. Now, keep in mind, this is just the beginning of the year. It's April now, and as the year goes on, we're going to more than likely be notified of some additional breaches that have occurred in the healthcare industry. But if you notice, if you look over to the right-hand side where it says location of breach information, it's one of the things that I want to put an emphasis on. The majority of them are email, which means that the majority of these breaches are caused or initiated by individuals within the healthcare industry or within a particular office. The primary method is phishing, and we'll get into phishing and spear phishing attacks as we go further into the presentation. So I just want to make sure that you keep this in mind. Now, if you look at the individuals affected, the first one, I put that on top for a reason. 199,548 individuals were impacted. Now, if you think that's some protected health information that was compromised. So let's just look at that from a healthcare perspective. Let's say one individual that were compromised, or their record was compromised, and it costs an organization $5,000 per incident. So with $5,000 per incident, you can just simply do the math and tell you about how much it's going to cost your organization. And then multiply that at least by 2 to 3 times, because you have legal costs, et cetera, that's going to add on to the top of it, that's going to cost your organization a tremendous amount of money. So as we go through this, just keep in mind, is it better to invest into the training for the individuals in your organization, or do you want to pay the money on the back end? So this is just something to keep in mind. When I say about awareness, it comes with understanding. If you very rarely have interactions with your CEO and you get an email from your CEO, that should raise a red flag. So let's talk about some healthcare coronavirus stats, things that are occurring right now. Okay, since this coronavirus has occurred, cyber attacks have increased 150%. And that's just in the healthcare sector within the last 2 months.
That's scary too.
That is tremendously scary. This is something, and it's not just in the United States. The Brno University Hospital in Czech Republic was running a test to help deal with the COVID-19 virus, and their hospital network was shut down by some bad actors. 100% of the web apps connected to critical healthcare information and platforms are vulnerable. And what I mean by that is, say for instance, you have an Apple iPad that's connected to, and you're walking around and one of your nurse practitioners, one of your nurses is utilizing that to take patient stats, their vitals, et cetera, putting information in there, or the doctor's going around making his or her rounds about some information. Well, that's how they're getting that platform, that iPad is access to an electronic health record. It could be to an EKG. It could be to the MRI machine. And with this Internet of Things, these additional Internet platforms or technology, there are increased vulnerabilities that need to be secured as well. The Internet of Things, or IoT, these are devices that are utilized to conduct cyber attacks as well. And what I mean Internet of Things, if you have an Apple Watch or a Samsung watch, or like I said, an Apple iPad, or let's say you have internet in your vehicle, or you're using a Fitbit, all those type of things are Internet of Things. If you have like the smart homes where you have your thermostat and your refrigerator and all this stuff is timed in, those things are considered the Internet of Things. And there are certain measures that you can utilize to ensure that no individual can penetrate your Zoom session. One of the things that's quick and easy, as if you're a presenter and you present in a Zoom session, once you have, I would take a list of all the individuals who are going to supposed to be attending your Zoom session. You should also set a time. Example, that would be, okay, the Zoom session starts at 10 a.m. No later than 10 minutes after, we are going to lock the session. If you want to get into the session afterwards, you'll have to send an email to us so we can grant you access and allow you in. That is one way that can shut out bad actors from penetrating some of your Zoom sessions.
Sure.
Health agency websites have been attacked with misinformation attacks. The Health and Human Service website here in the United States, the Champaign-Urbana Public Health District website in Illinois has been attacked. Also, the Centers for Disease Control has been attacked. Phishing and social engineering attacks are the primary tools for cyber hackers. Phishing, and we'll go into that, but it's basically what it sounds like. It's spelled a different way, but it's just like you're anticipate that the hacker has a fishing wheel, a fishing rod, and they put worm on it, put the bait on it, and they throw it out there into the ocean trying to catch a fish. Well, the hacker is the fisher, and the fish is you. And they're putting that bait out there, something that they think you may be interested in until you bite. And once you bite, then they have you. Also, social engineering is something that most people are victims of, and they don't even realize it. And so I'll go into more into details with that throughout the presentation, because I have specific examples. Fraud schemes, these are surging big time. There are individuals out there that are saying that there are actual cures to COVID-19, saying that, hey, if you contact this website and send some information over here, they will send you some information, some medication that can help protect you from getting the COVID-19 virus. Within certain platforms or certain software, there are vulnerabilities. And I'll talk about one that's prevalent and most people may have on their computers. Now, Internet Explorer, for those who use Microsoft systems, has changed to Microsoft Edge. It has been known, well known, that Microsoft Edge, again, used to be IE, had vulnerabilities where hackers could influence the website, have access, and get your information about you or your organization. This is one way they get in. They penetrate these known vulnerabilities that are published on the dark web. And you can go out there and rarely get these and say, okay, if you put this code in, you can get access to these certain platforms. This is how they get in. They utilize these vulnerabilities. They involve personnel within a healthcare organization. And the first way they do that is that they eavesdrop. Like, say, for instance, you are in a common area within your lobby or your atrium of your healthcare organization. And a person sitting in a nice suit has a briefcase thinking, and you look at them just from the outside, you think, oh, they're here to conduct some business. And maybe they're waiting for someone and they have a newspaper and they're sitting back and they're just reading the newspaper. But what you don't realize is that they're eavesdropping on the conversation that normally occurs in the atrium out in the open. And it's innocent a lot of times. We do that without even knowing. We sit back, you go, hey, Jim, hey, Bob, how's it going? Oh, how's the wife and kids? Oh, yeah, they're great. Yes, Sal, we had a soccer game the other day. And then Terry took her to a fishing tournament and we did this. And we talk about a lot of things that we do in our homes. Well, these cyber criminals are taking note of that. So they know who you are. Healthcare professionals, just like any other professional, we go out, we break bread, we go to social gatherings, we talk, we chit chat, and we do things in conferences. We do that at local and watering pubs and things of that nature. Well, cyber attackers are there as well. They social engineer, they talk to you, they get to know you a little bit better. Software, okay? Most vulnerabilities are included with it, they have a design flaw. When you have a design flaw, you'll normally get information or email or a phone call from your IT department telling you that, hey, this patch, you need to restart your computer, upload this, install this patch. The reason why they're telling you that is that a software vulnerability has been detected, and in order to ensure that the network is secure, this patch needs to be installed and your system needs to be rebooted. One notable one that just occurred involving Epic now, but what people didn't realize is that within Epic, there was a backdoor installed. And so the way things occurred is the Epic software engineers and IT professionals were managing the network, and then they got a notification from vulnerability to the software, and this patch was recommended, which is true. There was a patch that was recommended, but what they did not know is that a cyber criminal intercepted that message and then injected some malware into it and then let the message go ahead and continue on. It came from a respectable email address. Everything else looked kosher. Everything looked bright. And so everybody went on there, updated their software, installed the patch, etc. What they did not realize is that the cyber criminal injected some malware in there that installed a backdoor. And so a backdoor allows anyone at any time, a cyber criminal, to access your network or your software application anytime they want without being detected. Now, subsequently, they found out, they did through some administrative maintenance, that there was another vulnerability, and so it has been patched. But that's just an example of how a software application can lead to additional problems. Another way that vulnerabilities and attacks occur is that in healthcare, there is insufficient testing. Networks, insecure architecture. And what I mean by that is, okay, when you normally, like right now, we're working from home, and if we're logging into our healthcare organization, there's a certain authentication process that you're going to. Most organizations now use two-factor authentication. What that means is that the first factor is that you're going to enter your username and your password. That's the first part. Then you'll have another thing that you will have to choose from to authenticate yourself a second way. That could be another email coming, sending a code to you. It could be the dual system that's on your cell phone, and you have to authenticate it. They'll send a message to you. And if you don't authenticate the second factor within a certain amount of time, it times out and your access is denied. As I alluded to earlier, let's talk about social engineering. This is the social engineering cycle. And now sometimes it occurs in different ways, but this is usually how it goes. It starts with gathering information. After they gather information, they plan the attack. They plan about how they're going to get into your system and do some damage. They acquire the tools. Then the attack is executed. Once the attack is executed, most networks or most individuals react a certain way. Sometimes they anticipate this, sometimes the hackers do not. As a result of the way they react from the attack gives them information, and they use that acquired knowledge, and they go back all over again and start the social engineering cycle all over again. An example, okay? One example is that a hacker gained access to a system discovered after suspicious activity. This happened to be Med Associates here in the United States, and as a result, 270,000 records were exposed. Phishing, this is the big one. You more than likely have been contacted with a phishing attack, and a lot of times if you have junk mail or have your good pop-up blocker on your emails, it automatically routes it to the spam or to the trash folder because it detects that. But hackers are really good. So they put things out there to stimulate your interest. If you're a golfer, like I am, I get things from Golf Now and all these golf warehouse places that offer certain deals about a discount on shoes, golf clubs, etc. I have to pay attention to those things because I went to their website, but it could have been intersected by a bad actor, and they use that information and then try to penetrate my network. Okay, as you see right here, there are several steps in a phishing attempt. Number one is the initial list of compromised email accounts. They get this information, but they don't put it out there, okay? The second thing is they push new versions of malware, and they push them onto your servers or certain areas, drop zones, even drop boxes. Those things are penetrable as well. The next thing they do, they want to infect or compromise. Following that is exfiltration of account credentials. When I mean exfil, it's just what it sounds. It sounds like they're extracting that information from the server or from the network. Then once they get that, they don't go away. They usually go back again and gather more email account credentials. And then after that, then at that point, more than likely, you're going to be notified, and your IT department's going to notify, hey, there's been an infection somewhere, and there's been a compromise. They also like to attack high-profile victims. And the reason why they do that is because the bigger you are in a company, the more influence you have, the more access you have to revenue, and that's more than likely is the purpose of their attack. And then exfiltration. They want to get in there, get out, and then they look at another way to try to come back in. These are the ransomware attacks. Example of a ransomware attack: a hacker gets access to a network, inadvertently given file with personal data on there. Health Management Concepts lost 502,416 files just as a result of that ransomware attack. Now, that doesn't mean that the attack is over. Again, they may have paid the ransom and they got those files back, but each one of those files can still be compromised. And as a healthcare organization or a healthcare professional, the thing that most people need to understand now is you need to have a plan as to how you are going to address a ransomware attack. What is your bottom line? How much money will you or will you not pay? What are you prepared to do? These are the ones that a lot of people see in movies and whatnot. When you see the computer hacker typing away in their computers and looking like they're going really at it and typing a whole bunch of code. Well, I know some hackers that can do it really fast like that, but most of the time it's not like that. They're sending stuff out and they're waiting for responses. And one way is a direct attack. Gain direct access to the application privileges. They basically bombard your attack one way and go directly at Microsoft Outlook. Instead of penetrating like PowerPoint or Word, they're specifically talking trying to penetrate Microsoft Outlook. The indirect attack is that they gain access to a laptop, which is trusted. And through that trusted application or tool or equipment, then it gives them access to their desktop and then to the network. Usually hackers launch multiple attacks. Another such example is Oklahoma State University Center for Health Sciences lost 279,865 Medicaid patients. Brute force attacks. It's when there are multiple attacks to your network and it's bombarded. Now, there are multiple mitigation tools that your IT personnel implement to prevent certain things like this. One of the things is if you go into a website or into your organization and you try to log in, you know your username, but you just changed your password. And the first attempt, oh, I forget it. Oh, man. Okay, let me try it again. I think it's this. You try it a second time. Oh, no, that's not it as well. Okay, then you try it a third time. And then it says, well, you have to contact the system administrator. Your account has been locked. That is a brute force attack mitigation tool. It is set up that way to prevent multiple attacks from hitting the system and shutting down the server or the email server through multiple attacks. And this tool that these hackers use is an automated tool that they just plug in, that they utilize another attack called a dictionary attack, where they use all kinds of numbers, codes, letters, and inject that all one time to the system to basically make it fail so they can gain access to your network. An example, like I said before, hackers submit many passwords or passphrases, overwhelms the system to find a password and makes it fail. And that's how they get in. Now, this is one of the favorites of hackers. It's a backdoor attack. A backdoor attack is they access a system that is compromised. And before the entity or in this situation, the healthcare organization detects it, they inject the malware onto a platform. It could be Microsoft Office, could be Microsoft Word, it could be Epic, and they inject it in there and they leave your network. And so before you know they're there, they've already established a session with your organization. And so instead of them going through the hard route and attack your system directly, they already have a backdoor way in. So they go to a certain place on your website, they enter this information, and they are going to your system. And then they sit back and they just monitor your system to get whatever they want to whenever they want. Such an example of that is the orange worm backdoor attack. Installed Quampress. I always like that word, it's really funny. Quampress backdoor is sort of like a vampire. That's what I always think about that one. It was really, really interesting. So this one, I always tell healthcare professionals to pay attention to. It impacted large healthcare organizations through the MRIs and the X-ray machines. So let's just think about that. We're not even talking about the malpractice. I mean, the attack on the MRIs. Think about the potential malpractice that may be associated with that if a hacker happened to attack the MRI or X-ray machine during the administration of such an examination for one of your patients, and it's been misdiagnosed, person is diagnosed with something else, something goes wrong, and then you have to think about malpractice and all the other things.
Yeah. I did see hackers were adding in cancer tumors into lung scans, and that's probably one of the worst things I've ever seen with all of this. We spoke about that at a HIMSS conference recently, and I mean it's just terrible. It's sad to think somebody would do that, but it's amazing to think that people will do that and that we're not prepared to fight against that. So
exactly, and you know, they could be tag teaming with some fraudulent actors. Windows XP systems. Now, there are, unfortunately, I like to think that Windows XP has been updated. Now, everybody should be on Windows 10, the newest version, and But there are some out there that just don't have the revenue to update their systems. And if you have a Windows XP system, your system is susceptible to a backdoor attack. Okay, denial of service or distributive denial of service attack. All right, what that is, it is an example of attack that overwhelms your server. Like say for instance, you want to get access, you want to print something from the printer room. And instead, you normally go through your network, and then your network goes to the print server, and then the print server sends that request to the printer, and then your request is executed. However, hackers penetrate your network and they attack the print server. And what they do, they attack it in such a way and send so many requests that you will get a message saying, oh, this printer is not available or is undergoing maintenance, all this type of stuff. In some circumstances, that may be true. In other circumstances, it may not be. And it's because the attacks have been distributed from different areas to the point where it creates a denial of service. So you cannot get access to that print server or to that email server or whatever server contains that information within your organization. One example is the 2014 Boston Children's Hospital attack, and involved a patient being admitted and involved in a custody case. There was a network outage for a week, and it also involved Harvard University Hospital because they're intertwined. It took at least $300,000 to deal with it alone. You have first phase. This is a multi-vector or polymorphic attack. Okay, the first attack is that they will try to do a phishing attempt or a man-in-the-middle attack. And at the same time, that's phase one. And while you're over here trying to deal with this attack, they hit you again. And so it's like basically misdirection. They do a direct or brute force attack over here to your email server or your patient protected health information server, dealing or EHR or Epic. And while your attention is being paid over to this attack over here, they're attacking somewhere else and injecting malware through a backdoor. So it's basically a misdirection. So you're looking in one area, but when the actual big payoff is in another area. An example of such as a hacker launched a phishing attack and at the same time a backdoor attack. And this was through AccuDoc Solutions. 2.6 million Atrium Health patients were exposed.
Wow.
Man-in-the-middle attack. This is another one that a lot of people are susceptible to this day, even through your phones, your iPhones, your Samsung. All phones are susceptible to this type of attack. What it is, and this picture, it's a good example of it. Okay, you take your phone and you're trying, say you want to do some mobile banking, and you want to access your Bank of America app. And once you go into your Bank of America app and once you validate it, you're going to send the information to the Bank of America server so they can validate you and give you access to your account. Little do you know that someone next to you has penetrated your iPhone, and they have access to your iPhone and they install malware onto your iPhone. And so they are just monitoring everything that goes on, and they're picking and choosing what they want. So you decide you're going to contact Bank of America. So when you enter your username and password to Bank of America, they have your username and password. And so once you log off, they may wait a little while, or they may go right back in, see how much money you have, make a withdrawal or make a transfer, and then get out. Before you know it, you're like, oh, wow, did I spend this money? If you're out shopping and you do a lot of shopping, you spend like $300 or $400, all of a sudden it'll look like $1,500. And so unless you know what you're spending, it'll be a while before you realize that you've been victim of an attack. This also is known as spoofing. An example of spoofing is several hackers accessed a company website, compromising customer data. CNO Financial Group, that deals with a lot of healthcare organizations, had 566,217 records exposed. First of all, number one, you have to look at the domain. Is it a legitimate domain or not? Number two, look in the middle of the URL, which is the universal record locator, the www, in this case, www.example.com, to ensure that it's real. Highlight the entire thing to make sure that you can read the entire URL. This number three over here is the remaining part of the URL, where if it is a fraudulent web address, that information will be provided right there. Number four is the body of the email, okay? Favecon websites can put whatever they want up there, number one, okay? Number two, the domain, this is part of your URL and it's trustworthy as long as you know what to look for. Number three, the file path director, this is part of the URL that is, and it's trustworthy, again, as long as you know what to look for. The web contents, this area can be whatever they want it to be. Okay, say things that are convincing, that sound like it's official coming from your organization. One of the things that often gets overlooked are typos. And that's a key indicator if it's something fraudulent for you to watch out for. Okay, additionally, you may get something like this. It looks official, looks like it's coming from Google. It has the Google picture up and upper left logo. And it's like, oh, that's Google, looks like it. Okay, so they'll come up there and say, someone has your password. You're on alert at that time. So the next thing you look for that shield and you think, oh, someone has my password. Oh, it says it's red, I need to fix that. Well, that's just where they want you to do. They'll say, hi, William. But if you look at hi, William, there's something wrong with that. There's no colon. There's not a comma there, and proper email formatting could be an identification tool. Also, if they provide you something like that, it says the details, Tuesday, 22 March, okay, the IP address, they give the IP address, and then the location, it says Ukraine. All right, 4, what to look for. Here are some of the things that you need to pay attention to when you're looking at this. For example, this is just Google, but in other websites and URLs, you need to pay attention to this stuff as well. Okay, that S again stands for secure. The index.html, that's the file path. This is hypertext markup language. If it has that, that's legitimate. Okay, here's some other things that you'll notice. HTTPS, again, and the domain.com. You need to pay attention to these indicators up there. If you see something like .com, that's legitimate, .edu, .gov, look for the lock. And most of your, and I like to do this in all my emails and all my web addresses. And where the URL is, look and see if there's a lock to the left. If there's a lock, that means that it's secure. Also, it can say verified company. If it's verified, then that's good to go. But you can also access the certificates by clicking on it, and it'll take you to the actual certificate and provide you some information as to whether or not that certificate is actually valid. And we'll touch on that next. On most websites, if not all, you'll see these logos. However, if you touch on them, you click on them, it'll take you to the certificates and the trust seals. These trust seals have information that tells you whether or not that certificate for that particular website has or has not been validated or updated. All you have to do is click on them. And when you click on them, this is what you'll get. You see the site name. This is secure socket layer / tunnel layer secure certificate. What that means is that this right here is an actual encryption protocol that's utilized to secure the internet. It has the information, the date it was valid to when it's not invalid, the actual site name, the company organization, the encrypted data transmission protocols that it utilizes, the identity that's been verified, when the last time it was scanned for malware, and some additional information. All these certificates have this. It just means taking a little bit more time to verify that the website that you are actually going to is legitimate. And it takes a couple of seconds. You just go on and click on it, you read. okay, it's good to go, and continue doing what you were going to do. Okay, so what should we do? All right, here's some things that can be implemented and changed right now. First of all, every healthcare organization needs to have consistent and constant awareness and training. It is not beyond the realm of possibility to overtrain your employees or your organization on being aware to vulnerabilities of cyber attacks. The more you know, the better you are more prepared for. If possible, utilize a trusted VPN technology for business whenever possible. Virtual private network. Now, some of these VPNs out there are not good. Some of them offer backdoors. Zoom, you can change your screen sharing to only host only, lock your sessions, and make sure your software is updated all the time. Create or modify your telework policies. All right, since this is the age of the coronavirus, there needs to be policies that go along with that. You need to make sure that the software is updated, make sure that you tell your personnel to secure the equipment that they're utilizing at home. If they go to the store and go somewhere, instead of putting it on the lap, on the chair in the front seat, on the back seat, take it out of that, put it in the trunk, lock the trunk. That's a good way to secure your physical equipment. If you have information, all right, that information should not go any unnecessary places that it doesn't need to go. If it's on a thumb drive or a USB drive, again, lock that up to a place where it cannot be accessed by individuals that may or may not come over to your house or may have equipment that can scan it and get that information. The next thing, harden your IT network. More firewalls, two-factor authentication, password or email lockouts, 2 times, 2 or 3 times. Make sure that they cannot use the same username or same password within a 6-month or to a year time frame. And if you do that, that forces them to change it every 3 to 4 months to ensure that no one can hack into your system, find out exactly what it is, do a password attack, and then discover it. More readily changing it makes your network more secure. Another area is to be aware of illegitimate organizations collecting money for COVID-19 relief. Ladies and gentlemen, they are out there. They are coming up with these false organizations to make you think that they are legitimate when they are not. People want to help, and they're preying on their kindness and get these people to send money because they're thinking that it's going to an actual COVID-19 organization that's helping out. Go to those trusted organizations that have done things in the past, verify that they are still in business, and if you want to donate, you can do it through that. But only do it through verified legitimate organizations. Okay. The next one is employ cyber hygiene and security measures. What do I mean by that? Training, first and foremost. Training. Credential restrictions. In other words, just like in the HIPAA, we did with HIPAA, if you don't have a need to know, you don't need to know. The same thing needs to be employed within your healthcare organization. If you do not need to have access to certain things, you need to employ restrictions. Only those people that need access should be given access. If you do not, you need to block them, okay? Get some software to block robocalls. Robocalls is another methodology or tool that they can get access to your phone. When you click on there, you're answering, you're saying, hello, hello, and no one answers. At that time, when you answer, they have just penetrated or potentially penetrated your phone and have connected to your website or your network, then they have you. Website verification, like I explained before. Verify before you go in there and do some things. Another thing is be aware of COVID-19 scam advice. Cyber criminals are posing as individuals from the WHO, the DHS, and the CDC, just to name a few. They are posing, trying to sound all official and saying, hey, you need to do this, you need to do that, so we can fight this coronavirus, and they're fake. And last and surely not least, I tell people in healthcare, you need to engage in some penetration testings to identify vulnerabilities for your network. Does it mean that you have to pay for a consultant to come in an organization? Yeah, but the benefits will outweigh the cost. if you can invest that money into making sure your network is hardened and secure, it prevents potential large-scale breaches of PHI or other materials in the long run. And these are my references. And at this point, what are your questions?
Well, fantastic presentation, very detailed. I mean, you covered most of it. I had a lot of COVID questions. I think you did nail most of them. Do you have an email address? I don't know if your email address is on here in case anyone has any specific questions regarding security, or can you give that out?
I didn't put it on there, but I'll give it to you right now. It's M as in Mary, A as in Apple, M as in Mary, 8145 at psu.edu.
Excellent. Well, I appreciate it. I mean, very important, very timely information, especially with everyone working from home right now with COVID. So I would assume you're going to get probably some follow-up questions, and I just really appreciate it. I learned a lot. You answered, I had a list of questions, but you really did answer them all here. So Mark, I greatly appreciate your time. I'm sure everyone does, and really appreciate the presentation today.
Oh, thank you very much. It was a tremendous pleasure to be able to help out the healthcare industry